Hi, thanks for joining us. We are here talking about a pathway to universal health care. I'm Senator Emily Randall, and this is my colleague from the House.
I'm Representative Noelle Frame. Thanks for joining us.
And we are joined by some amazing advocates from the community that I want to introduce you to. Jill Levine, Gina Owens, and Ken Faber, a doctor from Bainbridge Island. And together we're going to talk about some of the issues that are facing all of us living and working in Washington State around staying healthy and being able to afford to keep ourselves healthy. Just really quickly, I'm going to give an overview of the bill, and then we'll hear from our guests who have been so generous with their time to join us. This bill, A Pathway to Universal Health Care, is SB 5822 in the Senate. And Representative Macri Representative Macri introduced
Yes.
I
am not Representative Macri.
Nope. Representative Macri introduced the companion co-sponsored by Representative Frame in the House, 1877. And we're here because we both care about healthcare and ensuring that everyone has access to healthcare that's affordable, that's high quality, that's comprehensive. And this bill is a way to get everyone in Washington covered. We're building a work group that will figure out the best way forward, bringing in all of the studies that have been done so far and figuring out the political path forward. One that is dependent currently on, or I guess one of the barriers currently is a federal government that doesn't share our values around healthcare and keeping everyone healthy in our system and making sure that everyone has access to the healthcare that they need.
And I think what we're acknowledging is that we know that today we wouldn't be able to get the Medicaid waiver from the federal government in order to, adopt a universal health care system overnight. Like, we know that. That's the reality in which we're operating. And so we are creating the structure to figure out how we do get to universal health care in the state of Washington. So if that changes and we have a federal government that's willing to give us that Medicaid waiver, that we're ready to go. And I'll just share that, work groups, when you are trying to do transformational policy, work groups are actually a really good way to do it. This creates for us, a process that we'll have to implement over multiple years to get ready for this. And I think for folks that don't spend every day here at the legislature, it may, not feel like it, but it is actually a gigantic step towards moving us towards universal health care. So really excited to be co-sponsoring this bill and so grateful to be here tonight.
Yeah, and I spent my career, 10 years working in healthcare advocacy and ensuring that folks across the country had a better shot at getting the healthcare that they needed. And I will say, following up on what Noelle said, that from an outside perspective, I thought that as soon as we had a big majority, a healthcare majority in the legislature, that we'd be able to push through the best policy right away. And now on the inside, I understand the intricacies of ensuring that we can fund it, that we have the support, and that we are prepared for a sustainable solution, one that can't get the rug pulled out from under it as soon as elections change and as soon as we have different members in the legislature. We want a system that is going to continue to care and cover all of us. So with that, I would love to let our panelists share a little bit about their healthcare stories, what brings them to this work. Let's see. Is anyone excited to start? Gina, do you want to tell us a little bit about your healthcare story?
Yes. So I'm Gina Owens, and I've been a healthcare advocate for about 15 years. In 2006, my 27-year-old daughter fell ill and began missing work. She was a fast food manager with healthcare supplied from her employer. Tiffany was diagnosed with pulmonary hypertension, and many days she couldn't make it to work, so she lost her job and her health care with it. When I tried to get her on Medicaid so she could continue getting her care and treatment, she was told she worked for a full year prior to looking for Medicaid, and she made too much money. So she didn't qualify for Medicaid. She didn't get the Medicaid, she didn't get the care she needed. We lost my daughter in June 2007. Since then, I've been working at rallies and healthcare forums and town halls. My grandchild and I became prominent faces of healthcare. We actually were a part of the healthcare reform fight, and because of the 3-year fight from 2007 to 2010, then President Barack Obama, the White House called our house and said, Obama wants you and your grandchild at the bill signing. So my grandchild, Marcellus Owens, was the 11-year-old in the magical pictures as Obama was signing the bill. We did that because when we lost Tiffany, it was important for us, looking at the nation and our health care, that we try to fix it so that no one else, no other kids would live without their mom. No other people, like all of us, would be denied health care. There's something that I like to call disqualifiers. And those are the things that healthcare entities like insurance companies and pharmaceuticals, they will try to say that for one reason or another you don't qualify. That should never happen. No human being should ever be told that they don't qualify for a basic human right, a basic human necessity. That's awful. We need to change it. SB 5822 is the first step in making that happen. We can do it. If we all work hard, we can do it. I want everybody listening to this Facebook page and to Senator Randall and just know that. Put your hands in the pot so that we all, everybody, no disqualifiers, can get the health care they need.
Thank you for sharing your story.
Thank you for having me here.
Of course.
Okay.
And
Why don't you go next, and then we'll kind of put a little medical spin on some of this.
Okay, so I am Jill Lean. It's hard to think of it in terms of a story, but I'm trying to think of how this is a story. I own a small retail business, and I've been self-employed for the last 15 or 16 years. I've always only been eligible for individual insurance. I've always had to go at it from that angle. I've never had a company that's helped me along to be covered in any way. And many times that individual insurance was just too much in terms of the percentage of my income to be able to afford. And what I heard a lot from people is that you gotta have insurance, you have to have insurance, what if something happens, what if something happens? And I actually worked to be able to get to a point where I could afford to pay for my individual insurance, and I've had it for years, and it's about 15% of my income, just for the premiums. So that's kind of a big chunk. And on top of that, we all know about deductibles and whatnot. And then eventually something did happen. I had a serious health issue come up that nobody actually knew what was wrong. I was in a lot of pain and wasn't able to work and was out of commission. It was difficult to make decisions. And I had a lot of things thrown at me in terms of like what I should be doing to be taking care of myself and figure out what this problem was. And I wasn't very clear about how to make all of those decisions. And I didn't actually even really understand that, what that meant, though, is that I was going to default to what doctors were telling me I absolutely needed to do to figure out what was wrong. And ended up then with, healthcare costs that I couldn't afford. I ended up with almost 30% of my income that year going to pay towards healthcare costs, and then it carried over. There was debt that carried over for several years after that. And this is an ongoing situation. They actually still haven't defined what's wrong. I still have to deal with it, and now I just have to, since it's gotten a little better, I can make choices now, but that is the choice. The choices I usually have to make is take recommendations for doctors and sort of weigh whether or not I can actually, and my family can actually afford for me to get different treatments that I need. So, that's the guess about it.
Thank you for sharing.
Those are both heartbreaking stories. They're different, but for someone not to be able to get care when they need it is, I sort of have this mental image of, would anybody in the United States who has a beating heart walk by someone in a parking lot who's bleeding to death and not do something? And the answer is no. I mean, I guess there are a few sociopaths that might, but by and large, that's who we are. We're not people lacking in compassion, but we've structured institutions and allowed a system to kind of develop that is heartless and cruel and indefensible. It destroys people's lives, it destroys people's finances. The leading cause of bankruptcy is getting sick in America.
Yeah.
How can it be? I practiced primary care for almost 40 years, and I saw too many stories like this. And literally, someone needed to see a specialist. They needed to have a procedure. They needed to be in the hospital. Patients told me, I'm not going to the hospital, doctor. Do what you can, because I can't, I'll lose my farm, or I'll lose my kids' college funds. Those are the choices that the system forces on people, and it's morally wrong. I'm not a policy wonk, I'm not an economist, I'm not any of that, but we need to sort of couch the whole argument in moral terms, because it's disgraceful. I got disgusted enough that I went to New Zealand for a while to practice. It's a single payer system, and it's kind of meat and potatoes, but everybody is in it. Everybody who has the equivalent of a social security number is covered. There's none of this gotcha stuff.
Right.
Oh, you don't qualify. Oh, you haven't been at it long enough. You don't. People said deductibles out of pocket. They don't know what that means. They said that's kind of weird language. But it's all artificial concepts constructed by the insurance industry to not pay people. It's the bottom line. And the single payer system there, you pay taxes, and the doctors are paid. The irony is, it was sort of mom and pop, almost old-fashioned. It was fee-for-service, market-driven. But the upshot was small towns. I worked in a town of about 6,000. Small towns could afford to keep their doctors because their doctors could make a living. They didn't get rich, but they were compensated reasonably. And there were then incentives built into the system. We had an extremely talented student from Auckland who was in surgery for 4 weeks. And I said, why are you, he was at the top of his class. Why are you here? Why, he said, well, I want to be a rural GP. And I said, well, how's the pay? He says, oh, it's the same as if we were a cardiologist, So there's pay equity, there's respect for primary care, it's a primary care base. So a lot of things are taken care of early, so it's not catastrophic. It doesn't end up in the ER. It doesn't end up in the ICU. Anyway, it just makes all kinds of sense. And in the process, they spend 9% of their GDP on healthcare. We spend 18%. They have better outcomes. I rest my case. I mean, it's a no-brainer. What we're doing is morally wrong, economically stupid, politically indefensible. Still got a few extra fingers. I can go. How we change that, I don't know, because we've created a monster.
Yeah.
Well, that's what this bill's all about.
Right?
And the monster is rearing its head. Just 2 days ago, the New York Times, they're gearing up. They're AHIP and Pharma and the AMA and the AHA. They're all gearing up with the same offensive that they mounted in 1949 and 1993. They're at it again, and we're going to have Harry and Louise back. We're going to have all of that propaganda. And these are big, powerful, rich corporations. And
Yeah, but I think there's a difference this year, Dr. Favorite, and that is the people are with us.
Yes.
And you said it's a moral issue, and I think we hear from our constituents every day, it's a life or death issue.
Yep.
And I think, the stories that we've heard today really illustrate that point, but that's what this group is all about. I appreciate it. You're not the policymaker, you're not sure what the pathway is. We are the policymakers, and we are creating a structure to get there. A pathway to figure it out and make sure that we've
I know where
considered
you
all
need to
those
be.
details.
Yeah. And we're gonna build the pathway, and it's about putting our values first and putting the people of Washington first.
Yeah.
And I do want to take a minute to welcome Representative Nicole Macri, another partner in the House who has long been championing healthcare for people in Washington. And I know she doesn't have long with us because she is busy making policy this evening. But thank you for being here.
Thank you so much for having me. I am so thrilled not only to see that this bill that we are partnering on is making its way through the legislative process, but it's really eliciting a lot of public dialogue. So I think that is I would say, one of the more significant things. We know the folks here believe that healthcare is a human right, that you shouldn't be wealthy to be able to get your very basic needs met, that everyone should have access to healthcare. And we know all the forces interested in keeping the status quo are real, just like Dr. Favorite said. And we know that there have been bills that have been introduced for years, for decades in the legislature that try to get us where we're trying to go, and they have not made any progress. And while this sets up the structure, what it's really doing is launching a really important conversation across the state. We're seeing some media stories about it. We're seeing more focus on us as legislators asking, what are you going to do? Because once again, the people of Washington are reaching a breaking point. So instead of looking, as I thought we would be when I first ran for office in 2016, at fixing the shortcomings of the Affordable Care Act, we are now, I think, faced with more fundamental questions about the entire structure of the healthcare system, and this bill pushes that dialogue. So I'm really excited that we're having these debates this session.
Yeah. And I'm so glad to have all of these voices in the room tonight. They're reflective of so many different conversations that I know all of us have had over the course of our advocacy. For the past year or so, I had thousands of conversations with folks in my district alone, as well as folks in the different healthcare areas that I was working. And every person that I have talked to has struggled to get the healthcare that they need, whether it's because their costs are too high, whether it's because there aren't providers in close enough proximity to where they live and work, because they're not able to afford their insurance deductibles, because they're excluded, because of some circumstance in their life that is not fair and it's not equitable. And we need to be doing something big and bold to our entire system. But we know that that's only possible if we bring everyone together, if we bring all the stakeholders into the room and we sit everyone down and say, we need to come up with a plan that will work for the people of Washington.
I think a big part of this job is not having all the great ideas, but bringing all the great
Yeah.
ideas in a
Yeah.
room and figuring out how they're all gonna work together and trying to reach a working consensus. And to me, that's what this really creates the structure to do.
Yeah.
So, we wanna make sure that all these voices that Senator Randall has mentioned have a seat at the table, and that we get the outcomes that we are aiming for. So, really put people Washington first, I think that was a good point.
If I can throw one thing out a step further, it's not just gonna have to happen at the table, that's necessary, but it's not sufficient, because people are gonna have to sort of quickly visible in a way that we haven't previously. I view this as nothing less than analogous to the civil rights movement, to the anti-apartheid. We have apartheid in this country.
Yeah.
We need to get rid of it.
Yeah.
It's immoral, it's unjust. It's the same, the healthcare is a human right. I mean, we have people who are not allowed to sit at the counter.
Yeah.
And that is wrong. That didn't go away because people were polite. It's gonna take that kind of work as well.
Indeed. Yeah, it has to be, we often talk about kind of the inside Olympia and outside Olympia strategy. I mean, movement building is gonna take more than just a stakeholder group. But legislative action, moving in the right direction for the first time, I think, in a long time, is gonna be a critical part of continuing to shine a light on where there are problems and where we need to make improvements in expanding access, driving down costs, improving quality and access, and of course, in improving affordability, because that's a big barrier for many people.
And we need to sort of bust the myths. I mean, they're you still hear this phrase, socialized medicine. That's an artifact of a PR firm in 1949 who fought Truman's universal health care plan successfully. Baxter and Whitaker, they wrote the book. There was a book called The Lie Factory. You should read it. It's unbelievable. And their techniques, direct mail, propaganda, I mean, they've influenced everything, and to this very day. But the point is, those myths need to go away.
Yeah.
We need to bust the myth that we have the world's best health care. Some people do.
Yeah.
Right.
But we ration healthcare, not making you wait to get your hip replaced. We ration it by saying some people get everything, and one would argue sometimes too much healthcare. There's that problem. And some get nothing.
Yeah.
And that's rationing. And they say we'll have too many, it'll raise taxes. The $1,900 I paid for the Affordable Care Act policy for my family before I turned 65 with a $7,500 insurance industry. So we need to sort of call people out.
Yeah.
Yeah.
Can I elaborate on what you just said about the rationale?
Yeah.
When I talk about everybody being covered, when I say the words nobody should be excluded, there are groups of people that we actually exclude. When you're talking about the rationale and how we give so much to some people and some people don't get it.
Yeah.
People look at me and low income groups and students and these groups who technically do get some health care. But the groups that I see get left behind all the time, and I want to see them come to the table and be a part of the process so they can get covered. We're talking about immigrants. We're talking about those who are incarcerated, and if they get any health care at all being incarcerated, it's substandard. I'm talking about schools where nurses are only on staff 1 day a week, maybe 2. Those kids don't wait until the nurse is on staff to get hurt.
Right.
Or sick, or.
Yeah.
They need public health nurses in the schools 5 days a week
Absolutely.
Yeah.
for those kids.
Yeah.
Those kind of groups
Exactly.
where they never get touched,
Mhm.
never get thought of.
Yeah.
Those are the ones I want to see
Yeah.
when we're done with this.
Yes. Yeah.
Absolutely.
And we've seen quite a few reports about some of the healthcare disparities that are facing our system, and we know that we have so much farther to go. But I think we're ready for some questions,
Yeah.
so that we can bring everyone into this conversation.
Yeah, one question that came in is, I sort of remember that the legislature commissioned a study about universal health care last year. How is this bill different from that one?
So I worked a lot on the proviso that we created for that study. And preliminary results came out in December that looked at different models of universal health care, both ones that have been proposed in the United States and ones that are in practice in other parts of the world. And some of the factors around them, including some generalized kind of cost offset factors. And it set up a really good framework for what works in a universal healthcare model and looking at different models, including single payer models. The final results of that study are due in June of this year, so it'll be after the legislative session is over, and we'll have more details. The way this bill that we're talking about, the pathway to universal healthcare, is different. Is that it sets out some assumptions about the areas that we need to look at and the people, the stakeholders we need to be talking with. So it talks about things like working with other states for multi-state healthcare purchasing options. It talks about things like ways we can expand transparency throughout the healthcare system. We don't always know what's driving the costs in areas like prescription drug expense or hospital expense, et cetera. And the system is constantly changing. We've been talking a lot in our healthcare committees about the growth of an entity known as benefit managers. These are essentially middlemen who help to negotiate prices, and what we find is almost always the patient loses in that negotiation. And so the bill really gets far more specific than the study that was commissioned.
Another question that came in by email. When the work group comes up with viable solutions, how can they ensure that their recommendations are heard by the legislature so that real change is implemented?
Yeah. Well, we're not able to bind a future legislature to the decisions that we found, but it is the intent of all parties engaged in this process to move forward with the policies and the positions that we find viable. I can't promise that all three of us will be here, but I certainly hope we are. And it's not just the three of us that are advocating for this change. There are so many members of both the House and the Senate who are invested in this work, and they're going to remain invested.
Well, and I think the real answer is you all
Yeah.
are the reason.
Yeah.
You all are going to hold us accountable to getting that work done. And we'll talk about, our call to action at the end, but at the end of the day, it is you, the people of Washington State, keeping up the pressure and demanding that the legislature follow through with the intent of this work group and bring legislation forward. That's how it gets done. And frankly, as Dr. Faber said, we can't do it without you.
Right.
If, you try to do
Countdown doesn't work.
you try to do anything around here without, the help of stakeholders and voters, it doesn't really work.
Right.
So we're really gonna need your help.
Yeah. Because, traditional policymaking isn't what drives transformational change.
That's
exactly right.
absolutely true. Yeah, great.
Yeah.
Any other questions?
One question that just came in, I think, kind of in response to that. Is there a timeline in the bill, and who is it who leads the work group? Is there like a certain leader?
Yeah. So the Healthcare Authority is the convener of the partners, and in case you don't have the bill up in front of you, the folks in the work group are first and foremost consumers, large and small businesses with experience in large and small insurance and self-insured models, our labor partners, healthcare providers and facilities, health carriers, and the Washington State Health Benefit Exchange, along with other state agencies and, of course, legislators.
And I can speak from personal experience. I currently co-chair the Children's Mental Health Work Group, and I co-chair it with Marianne Lindenblad from the Healthcare Authority. And they have been incredible partners, convening experts, in our case, in the field of behavioral health as it relates to children and adolescents, and have legislation this year that is so technical. I just, lean on the smart, brilliant people that have been involved in this work. So I fully expect the same contributions in terms of leadership from the Healthcare Authority as we've seen in the Children's Mental Health Work Group and this work group on increasing or getting to universal health care in the state.
Yeah. And our timeline, 2020, the end of 2020 is the deadline for us to present a pathway forward. Yeah. Is that it? Yeah.
So call to action then.
All right. What do we do
I
next?
have one question.
Oh, yes.
yes.
Go ahead.
When you all say consumers are
Yeah.
part of the work group,
Yeah.
what are you talking about? What kind of consumers? Who is it?
Yeah. We need people like you.
I know, isn't that
Yeah.
Okay,
it's
I'll
not
find
an
somebody.
It's not an ideal word, but I think
Right.
we mean people.
Yeah.
So that could mean patients, it could mean residents of Washington.
That's what
You
I
know,
need to come
yeah,
out, because
yeah.
they need to hear it.
Yeah.
We're
yeah.
all prospective patients.
Yeah,
Yeah,
we
Every
are.
one of
really.
us,
Yeah.
we could get sick at any time.
Right?
And so we're all in this together.
Yeah.
Absolutely.
I worked with someone who always said everybody with a body needs health care.
Yeah.
Yes,
Absolutely.
And if you don't now, you will.
Right?
Yeah.
Right?
Exactly.
No disqualifiers.
No.
Absolutely.
Yeah. Yeah.
So,
So,
we've talked about what role you all can play.
yeah.
And I was hearkening back as Gina was talking about the bill signing and the Affordable Care Act and that first big step in the right direction. I remember then President Obama saying at the beginning of that fight, make me do it.
Yeah.
Make me do it, demand that I do it. And so one of the things that we always encourage folks that, we're obviously here supporting a pathway to universal health care. So we agree with you. So some people are like, oh, I shouldn't bother contacting my rep because I know that they agree with me. No, contact us.
Yeah.
Tell us that you agree with us. Tell us your stories. Demand that we do this. And it helps give us, you have our back in fighting for this and putting as much energy into it. So contact us and obviously contact your own representatives and senators and encourage them to support this bill. And I know Emily can talk to us about some of the details and the next steps. of the
Yeah.
bill.
And thank them for doing the work to support.
Why, thank you,
Oh,
Gina. We will take your thanks. Very much.
Yes. So we definitely want you to reach out to your legislators, and there are a couple of ways that you can do that. You can drop your story in the comments right here on Facebook so that we have your stories to share with our colleagues. You can go to leg.wa.gov and look for Senate Bill 5822, and you can comment on it right from their website. You can also sign up for alerts on the bill to find out how it's moving its way through the legislature. Next step for this bill is to be heard in the Ways and Means Committee in the Senate on Wednesday. And from there, we'll continue rallying support, and they will hopefully exec it out. And then it moves on to the Rules Committee in the Senate, and then to the floor of the Senate, and then we pass it and send it over to the House.
Yeah.
So there are lots of steps on the way and a lot of times for you to continue engaging your legislators.
So if you're new to this process, I want to say that website again. So the legislature's website is leg.wa.gov, because we're going to put it up on the page.
Yeah.
The look up a bill function is right there on the left side of the top navigation. Put in the bill number, you'll find it. If you don't even know who your representatives or your senators are, you also have the Find Your District function right on that front webpage.
Yeah.
And I will tell you, take a look at the committee website, see if your member is on appropriations. or pardon me, not appropriations, on Ways and Means in the Senate. And if your senator is on Ways and Means, tell them tonight that you support this
Yes.
legislation, because that, the bill has to move out of Ways and Means before the end of the week. So if your member's on that committee,
Yep.
you have an extra special action step, tonight, so
Yep.
look them up.
Reach out. Any final thoughts from anyone? Messages?
Thank you for your efforts.
Oh,
I mean, it's 1975, when I was in med school, I had a bumper sticker on my battered VW Beetle that said, "Healthcare is a human right," and maybe in my lifetime, I'm gonna see it.
yeah.
So,
I mean, this is such important work, and it's work that I was drawn into from a really young age, a little after 1975. But my sister was born with special needs, and it was only because of Medicaid expansion that my family was able to give Olivia all of the health care she needed. And that's why I spent my career fighting for health care, and that's why I'm going to continue fighting alongside all of you and all of you until we get this passed. Yeah.
All right.
Thank you.
Thank you.
See you soon.